An overbite describes how much the upper front teeth vertically overlap the lower front teeth. Some overlap is normal, but excessive overlap require orthodontic correction. Brackets are attached to the teeth and connected by an archwire. Together, they apply carefully controlled forces that guide the teeth toward their planned positions. The force from braces triggers biological changes in the tissues around each tooth. This allows the teeth to move gradually through the supporting bone over time. To correct a deep overbite, the orthodontist controls the position of selected teeth and how the upper and lower arches meet. The exact mechanics depend on each patient's bite. As treatment progresses, the orthodontist fine-tunes alignment and bite contacts. Elastics or other orthodontic tools may also be used when needed. Once the planned correction is achieved, the braces are removed. Retainers then help maintain the new tooth positions while the surrounding tissues adapt.
Concerned about your bite? Book your orthodontic consultation today.